Hi guys, welcome to FastCoder 21 Medical Coding YouTube channel. The purpose of this channel is to help the people who are in need of medical coding reliable resources. If you are already subscribed to our channel, help your friends to subscribe. If you are visiting for the first time, then click on subscribe button to receive latest updates in the medical coding field. The channel is helpful for freshers, experienced coders, aspirants of AAPC certification exams and HEMA certification exams. If you have any other topics or concerns, please mention in the comment section. Please click on the like button to encourage and motivate us. Please watch until the end to gain in-depth knowledge about ICD-10 CM, CPT, ICPICS coding systems, as these sessions are very useful in live coding, medical coding interviews, AAPC and AHIMA certification process. Guys, if you go to any interview or certification exams, kindly keep familiar with the code books like ICD-10 CM, CPT, ICPICS, as our sessions will assist you in the process of interviews and certification exams, but not an alternative to original interview process or certification exams. Today our session is 2023 ICD-10 CM guidelines. So as we have received numerous requests from our subscribers, we have planned to start this session. So today our first session, ICD-10 CM 2023 chapter guidelines. Chapter 1, infectious disease and parasitic diseases with example scenarios. So guys, here we are going to learn guideline as well as with one example scenario which will make us to understand easy. So our code range is for certain infectious and parasitic diseases A00 to B99 and U07.1 and U09.9. So as per our guideline, initially we will start with human immunodeficiency virus infection, otherwise HIV infection. So first guideline is code only confirmed cases. Code only confirmed case of HIV infection or illness. This is an exception to the hospital inpatient guideline section 2H. In this context, confirmation does not require documentation of positive serology or culture for HIV. The provided diagnostic statement that the patient is HIV positive or has an HIV related illness is sufficient. So here for this guideline we are going to learn one example. So basically this guideline is telling us that we need to code only confirmed case of HIV infection or illness. So in this, confirmation does not require documentation of positive serology or culture for HIV, provided diagnostic statement is enough to code HIV related illness or HIV positive. So to better understand this guideline, we have an example here. So example, Kim is with possible human HIV, human immunodeficiency virus. Even though in the inpatient setting it is acceptable to code diagnoses that are possible or suspected. In the case of possible HIV, you would not assign B20. You would have to query the physician regarding the patient's exact HIV status. This is one of the only exception to coding diagnosis, as if it exists when it is documented as possible or probable. So basically in outpatient setting we will not code possible or probable conditions. But inpatient uh, like scenarios, we will code possible and probable conditions. But with the exception is here in during HIV illness. So in even inpatient setting also, we can't code possible HIV or probable HIV. Here we need to query the physician regarding patient's exact HIV status. So in the same scenario, instead of Kaposi sarcoma, if the patient has hemolytic uremic syndrome along with HIV, we will code hemolytic uremic syndrome first, then HIV code. That is 2023 guideline. So if the patient is admitted for unrelated condition. So if the patient with HIV disease admitted for unrelated condition, that means that condition is not related to HIV. For example, traumatic injury. The code for the unrelated condition So the nature of injury code should be principal diagnosis. Other diagnosis would be B20 followed by additional diagnosis codes for all reported HIV relation conditions. So we have an example here. So here patient admitted for traumatic closure fracture of the left femur in a patient who has acquired immunodeficiency syndrome. Here patient is admitted for unrelated to HIV condition. So here we will code fracture first, then HIV code, as this fracture is not related to HIV. Next guideline, whether patient is newly diagnosed. Whether the patient is newly diagnosed or has previous admission or encounter for HIV condition is irrelevant to the sequencing decision. So if the patient has previous condition or current condition, that is not a criteria code while sequencing HIV codes. While coding HIV conditions, we need to follow the guidelines. So whether patient is newly diagnosed or previous condition, that does not matter in coding HIV condition. Next guideline, asymptomatic human immunodeficiency virus. So usually asymptomatic human immunodeficiency virus will code Z21 is to be applied when the patient without any documentation of symptom is listed as being HIV positive, known HIV, HIV test positive or similar terminology. So if you find any documentation with HIV positive, known HIV or HIV test positive, we need to code Z21. So these are HIV positive only, but patient does not have any symptoms currently. So we need to code Z21 asymptomatic HIV. So do not use this code if the term AIDS or HIV disease is used for, or if the patient is treated for any HIV related illness or described as having any condition resulting from his or HIV positive status. Use B20 in these cases. So basically whenever we have a document, we need to check the keywords here. For example, if you see HIV, if the physician mentions HIV positive, non-HIV, HIV test positive, or similar terminology, we need to use J21 asymptomatic immuno HIV. For example, if the physician mentions AIDS or HIV disease, we need to code B20 along with HIV related illness. That kind of situation also we need to code B20. So we have an example here. The patient's HIV test last week was positive. The patient is asymptomatic. As per our keywords here, HIV positive. Here also physician is telling that HIV positive. So here we will code only asymptomatic HIV Z21. Next guideline, patients with inconclusive HIV serology. So patients with inconclusive HIV serology but no definitive diagnosis or manifestation of the illness may be assigned code R75 inconclusive laboratory evidence of immunodeficiency virus. So serology means it is like blood test. So if the blood test is inconclusive to identify the HIV, we need to code R75. So next guideline is previously diagnosed HIV related illness. So basically patients with any known prior diagnosis of an HIV related illness should be coded to B20. Once a patient has developed an HIV related illness, the patient should always be assigned code B20 on every subsequent admission or encounter. Patients previously diagnosed with an HIV illness should never be assigned to R75 or Z21 asymptomatic immunodeficiency virus infection status. So here we have one example. We can understand this guideline easily. So HIV patient with prior history of pneumocystis corneae pneumonia. B20. PCP is an opportunistic lung infection that has been identified as an AIDS defining illness. So what happened in this example? Based on our guideline, previously diagnosis HIV related illness also we need to code B20. So in this example, patient has prior history of HIV with pneumocystis corneae pneumonia, which is also a HIV related illness. So as the patient has previous HIV with PCP, we need to code P20 here. So here next guideline, HIV infection in pregnancy, childbirth and the puerperium. Here based on this guideline, if the patient is admitted with HIV during pregnancy, so if the patient is having HIV related illness during that visit, we need to code 098.7 along with B20 after that HIV related illness. The patient presents with asymptomatic infection, HIV infection, but the patient is pregnant. In that time, we need to code 098.7 and Z21. So here, pregnant patient is admitted. If she is having HIV related illness, we need to code 098.7. Here, pregnant patient is admitted. Here, there are no HIV related illness. We need to code Z21. So here we have few examples we can understand easily. Michelle is 20 weeks pregnant and is admitted for treatment of esophageal candidiasis due to AIDS. So here Michelle is 20 weeks pregnant, esophageal candidiasis due to AIDS. So because of AIDS, she got esophageal candidiasis. So how do we code here? Baseline guideline. We need to code 098.7 first, then B20, then AIDS related illness, which is esophageal candidiasis, third one. So next question, next example. Stella is at 39 weeks delivered, live-born twins vaginally during her hospital stay. The mother's HIV has remained asymptomatic. So here patient is asymptomatic. So we need to code J21. Next guideline, encounters for testing for HIV. So if a patient is being seen to determine his or her HIV status, we need to use code J11.4. Encounter for screening for human immunodeficiency virus. Use additional codes for any associated high risk behavior if applicable. So if a patient with signs or symptoms is being seen for HIV testing, code the signs and symptoms. Any additional counseling may be J71.7. So when a patient returns to be informed of his or HIV test result and the test result is negative, we need to code J71.7. So we have an example here. Because of high risk homosexual behavior, Kate is seen in the clinic for HIV screening here. So here we need to add Z11.4 and we need to use additional code for any associated high risk behavior if applicable. As homosexuality is a high risk behavior, we need to add Z72.52. And the second guideline is if the patient has signs and symptoms seen for HIV testing, we need to code signs and symptoms only. So Rob returns for test results that are negative and is counseled regarding HIV prevention. So this is for this Z71.7. We have one more guideline. One more example. Stella returns for test results that are positive and is asymptomatic. She is instructed regarding symptoms to watch for and means of prevention. So here patient is asymptomatic, but she is she came for results. So here Z71.7. So next guideline, HIV managed by antiretroviral medication. If a patient with documented HIV disease, HIV related illness or AIDS, so this yellow marking is 2023 guideline, is currently managed on antiretroviral medications, assign code B20, human immunodeficiency virus disease, codes, and also we need to code Z79.899. Other long-term drug therapy may be assigned as an additional code to identify the long-term use of antiretroviral medication. So we need to check the documentation for HIV disease or any type of HIV related illness or AIDS. So if we found any of these words, we need to add B20 and also Z79.899. Here we have an example. Janet was admitted for treatment of Kaposi sarcoma of the skin. Janet's HIV has been symptomatic for the past year and has been an antiretroviral medication. So here We will code HIV first, next Kaposi sarcoma, and as she has been on the medication, so we need to code Z79.899. So until now, we have completed HIV related guidelines with examples. Now we can learn these. Infectious agent as the cause of diseases classified to other chapters. So certain infections are classified in chapters other than chapter 1 and no organism is identified as part of the infection code. In these instances, it is necessary to use an additional code from chapter 1 to identify the organism. A code from category B95 Streptococcus, Staphylococcus or Enterococcus as the cause of diseases classified to other chapters. B96 other bacterial agents as the cause of disease classified to other chapters, or B97 viral agents as the cause of diseases to other chapter is to be used an additional code to identify the organism, and an instructional note will be found at the infection code advising that an additional organism code is required. So whenever one condition occurs due to any type of virus or bacteria, we need to use additional code from chapter 1. So we have few examples, so it might be easy to understand using these examples. So next example, code C is admitted to the hospital with pneumonia due to Bacteroides fragilis. So first, we don't have any direct code for pneumonia due to Bacteroides fragilis. So here we need to code pneumonia first, then Bacteroides fragilis. Here the guideline is same one. So if we don't have any combination code for infectious organism, we need to code from B96 series or B95 series or B97 series. Next one, Gregory is admitted to the hospital pneumonia due to MRSA. Here we have direct code. So we need to, here we need to code B95 or B97 or B96 series. So next guideline, infections resistance to antibiotics. Many bacterial infections are resistant to current antibiotics. It is necessary to identify all infections documented as antibiotic resistant. Assign a code from category G16 resistance to antimicrobial drugs following the infection code only if the infection code does not identify drug resistance. So whenever we don't have a code to drug resistance with the default code, we need to code Z16. So here we have an example. We are acute endocarditis. We need to code endocarditis and B series code and resistant to antimicrobial drugs.